Hi, I am CJ Devgn, and welcome to another edition of Breaking Barriers, where my goal is to provide you with proven tools to help you transform your business. We are living in times where business, as usual, is not sustainable. Because new disruptors are arriving every day, therefore, you too must reinvent and break barriers that are holding you back. If you are struggling to grow your business, check out my website at cjdevgn.com and learn about my consulting and coaching services, and let's talk.
COVID-19 pandemic has transformed the way care is being provided. We all have experienced transformative way the physicians are interfacing with us. Till February of last year, doctors would not share your results or refill your meds without you coming to their office. But today, telehealth has become mainstream. It is an effective method to continue to care and service patients while we fight the outbreak of COVID-19. So, what is telehealth? Delivery of healthcare services where patients and physicians are remote. Doctor or nurse cannot physically examine the patient. Clinicians provide care using the latest information systems, such as computers or other smart devices, to collect and communicate critical information with their patients remotely. For example, you use a mobile phone or laptop to access your confidential portal to see your test results, schedule appointments, request prescription refills, and in more advanced use cases, upload critical care to your doctor's electronic medical record system through Internet of Things, i.e. smart devices, to measure and transmit your temperature, blood pressure, glucose level, sleep patterns without any intervention. We have had the ability to set up virtual appointments where your doctors can see you via online video conferencing for a number of years. But policymakers were slow to adapt to these new methods of providing care. Pandemic acted as a catalyst to accelerate the adoption rate for telemedicine to protect patients, physicians, and other support staff. Because we have seen disruptions caused by technology in every other sector but healthcare. I have been a big advocate of the use of technology in the healthcare continuum as it is both convenient and centered around patients' need. If you listen to some of my podcasts from fall of 2019, I have spoken a lot about why we cannot bring these changes. And in a sad way, COVID has provided us that impetus to bring in technology, especially telemedicine technology, in the way we provide care. Because majority of us believe that 80% of our doctor appointments need not be in-person visits. At this time, I have to commend government agencies and policymakers to pivot and propel healthcare access for providers, for embracing telehealth, and to minimize exposure while continuing to care for their patient population. What are the benefits of telemedicine? So we understand during this COVID-19 period, telemedicine protects us, but even outside of pandemic, telehealth and telemedicine is really beneficial in number of different ways. So care services that do not require direct patient-provider interaction are great uh, candidate for telehealth. It improves access to care, uh, let alone developing nations and underdeveloped nations where we have a huge shortage of physicians. Even in countries, developed countries like Canada, we have shortage of physicians. And there are remote areas where we do not have the same density of provider as we have in major cities. So it does make healthcare accessible to people who live in rural or isolated communities. And the same applies to specialists. There are not a lot of specialists out there in these communities. Um, it makes services more readily available and is convenient for people who have mobility issues. I have older parents and they have sometimes challenged to go to a physician and they have to depend on one of us to come and pick them and take them to a doctor's office. Uh, so it becomes convenient for them to access and speak with the doctors. It helps in reducing total cost of healthcare as a system because remote care reduces number of resources you need in these provider centers. And most importantly, it improves communication. When you can communicate with your care providers through multiple different means, other than just physically going to their office, helps both physicians and patient populations. What are the barriers to telemedicine? Why it has not been mainstream for all this time? As the theme of this season is change, right? Most of us always resist change. Change is difficult. For patients, it is difficult. For clinicians, it is difficult. And here are some of the factors that make it difficult. Number one, I always believe cost. So, who pays for the cost of implementing these technology solutions? Two, I think legal and regulatory policies plays an important role. For a very long time, reimbursement was difficult, and physicians were not getting reimbursed when they were seeing patients remotely. Confidentiality, who owns the data once it is in physician CMR, and if you're seeing 5 different physicians, then how that data gets communicated and shared between providers. Interoperability, um, how will data get translated between various devices and systems that potentially will be built by different providers or vendors. Security, how secure is the communication between patient and clinicians' devices? Can hacker impersonate patient and steal critical and sensitive health data? And as I said, resistance to change. There's still section both in clinician as well as patient population who have a perception of in-person care. And last but not the least, lack of skills. We still need to train a large section of people both on provider side as well as patient side who are technology challenged. But I do believe in technology. Maybe it's my bias coming from technology background, but telemedicine is here to stay, even post pandemic. Providers of all sizes must develop a plan and make investments in various technologies to enable their staff to learn how to effectively use them to provide care and improve outcomes of their patients. Regulators and policymakers need to think about ways to change reimbursement terms so providers are incentivized to adopt these new methods of care. And finally, we need to educate patients, especially the aging population, on the benefit of telemedicine and technology skills required to leverage it effectively. If you or someone in your organization is involved in implementing telemedicine and would be interested in coming on the show to share your experiences and lessons learned, I will welcome you. So please contact me at cjdevgn@cjdevgn.com.
That is it for today. Thank you for listening. Let's go out and break barriers and generate new possibilities. Please be sure to visit our website at cjdevgn.com. And if you like our show, please subscribe, leave a rating, and a review for us on iTunes.